Which of the following is a typical clinical sign of aortic insufficiency in a pediatric patient? A. Exercise intolerance. B. Excessive sweating. C. Frequent epigastric pain. D. Mania. The answer is A. Exercise intolerance. Exercise intolerance is a typical clinical finding in pediatric patients with aortic stenosis. This condition may present with any of the other symptoms, but mania, excessive sweating, and epigastric pain are not directly associated with aortic insufficiency in this population. Parvovirus B19 causes which of the following conditions? A. Roseola infantum. B. Fifth's disease. C. Rubeola. D. Scarlet fever. The answer is B. Fifth's disease. Parvovirus B19 causes Fifth's disease, sometimes referred to as slap cheek syndrome, due to the bright red cheeks that often present with the infection. Scarlet fever is caused by group A streptococcus infection. Roseola infantum is caused by either human herpes virus 6 or human herpes virus 7. Rubeola, or measles, is caused by the measles virus. What is the incubation period for varicella, chickenpox? A. 48 to 72 hours. B. 14 to 28 days. C. 2 to 7 days. D. 10 to 21 days. The answer is D. 10 to 21 days. Varicella, caused by an infection with the varicella zoster virus, has an incubation period of 10 to 21 days. Which of the following infections is the most common cause of hand, foot, and mouth disease? A. Enterovirus 71. B. Human herpes virus 6. C. Parvovirus B19. D. Coxsackie virus A16. The answer is D. Coxsackie virus A16. The most common cause of hand, foot, and mouth disease in the United States is Coxsackie virus A16. Enterovirus 71 can also cause hand, foot, and mouth disease, though it is a less common etiology. Parvovirus B19 causes fifth disease, sometimes referred to as slap cheek syndrome. Human herpes virus 6 is one of two viruses that cause Roseola infantum. While doing a standard ophthalmoscopic exam on a 7-year-old female, the examiner notices that while the light reflex of the left eye is red, the light reflex of the right eye appears bright yellow. The right pupil is also less reactive to light, and the right eye appears to be slightly bulging. The examiner should be suspicious of which of the following conditions? A. Cataract. B. Hordeolum. C. Pincula. D. Retinoblastoma. The answer is D. Retinoblastoma. Retinoblastoma is the most common form of ocular cancer in children. It is derived from developing retinal cells. The most common symptoms are a white or yellow light reflex, also known as leukochoria, diminished pupillary reflex, crossing of the eyes, impaired vision, and bulging of the affected eye. A cataract may also cause the pupil to appear white or to produce a white or yellow light reflex, but it will not cause bulging of the eye. A pincula is a fatty deposit on the sclera which will not alter the red light reflex, and a hordeolum is outside the eye itself. It is an infection of a hair follicle of the eyelid, also known as a stye. A labor and delivery nurse is speaking to a new mother about her premature infant, and is explaining why the infant will have difficulty with heat regulation. Which of the following statements made by the nurse best explains why a preterm infant cannot conserve heat properly? A. The preterm infant has an immature hypothalamus, which cannot set the infant's internal temperature properly, leading to large amounts of heat being lost via convection. B. The preterm infant has too little protein reserves around the kidneys, the neck, between the scapulae, and behind the sternum, and therefore cannot generate heat and can lead to hypothermia. C. The preterm infant has a lack of subcutaneous fat, and a large surface area to body weight ratio, as well as the lack of brown fat that provides heat to infants due to its unique thermogenic properties. D. The preterm infant lacks white fat, which provides the infant with a heat source due to underdeveloped and the inability to utilize the process of shivering to produce heat. E. The preterm infant cannot generate heat effectively because of a lack of surfactant in the skin and therefore cannot generate or preserve a proper body temperature. The answer is C. The preterm infant has a lack of subcutaneous fat, and a large surface area to body weight ratio, as well as the lack of brown fat that provides heat to infants due to its unique thermogenic properties. A preterm infant cannot conserve heat due to several reasons. The infant has a lack of subcutaneous fat, has a large surface area relative to their body weight, a lack of glucose reserves, and a lack of brown fat, which is a unique type of fat that is capable of generating a greater amount of heat than just ordinary fat. What specific enzyme deficiency accounts for 95% of all cases of congenital adrenal hyperplasia? A. 7-alpha-hydroxylase deficiency. B. 21-hydroxylase deficiency. C. Beta-glucuronidase deficiency. D. Estrogen synthetase deficiency. The answer is B. 21-hydroxylase deficiency. In 21-hydroxylase deficiency, cortisol production is reduced, which in turn causes adrenocorticotropic hormone, ACTH, to increase. The precursors for the cortisol are then shunted into androgen production since these are steroids, and are thus derived from cholesterol. The community health nurse knows that teaching has been effective when the father of a newborn states dash. A. I will place my child on her back to sleep. B. I will place my child on her back and in a crib with stuffed animals to create familiarity. C. I will place bumper pads in the crib to prevent injury. D. My child will sleep in the bed with me until the first month of life. E. I will place my child on her side to sleep, supported by pillows. The answer is A. I will place my child on her back to sleep. Newborns should be placed on their back, in their crib, with nothing else when put to sleep. The crib may contain a fitted sheet or light blanket. Crib pads, pillows, and stuffed animals are not advised because they may interfere with the child's ability to breathe. The postpartum nurse is caring for a family and their new baby, a 2-day-old infant. The baby is spitting up following every formula feeding. The nurse may suggest dash. A. Giving only 15 to 30 milliliters per feeding. B. Laying the baby on its back after feedings. C. Switching brands of formula. D. Increasing the frequency of feedings. E. Using a soft instead of a standard bottle nipple. The answer is A. Giving only 15 to 30 milliliters per feeding. Typically, The digestive system of a 2-day-old infant can only accommodate 15 to 30 milliliters of formula comfortably. The infant's stomach will grow considerably over the coming weeks. Frequent spitting up could be due to overfeeding. Before switching formula brands, try decreasing the amount fed at each feeding. Increasing the frequency of feedings may add to this problem. Another possibility, that the infant is feeding too fast, may be corrected by using a slow flow instead of a soft or standard nipple. Soft nipples may be helpful in infants with poor suck or latch. While feeding and directly afterwards, it is advised to keep the infant in a semi-upright position. HIA therapy has the ability to positively impact children who are cognitively, socially, emotionally, or physically challenged. Which of the following therapies is most closely related to HIA therapy? A. Art therapy. B. Massage therapy. C. Pet therapy. D. Music therapy. E. Herbal therapy. The answer is C. Pet therapy. HIA therapy is therapeutic horseback riding for the handicapped. The motion of the horse can help the child develop flexibility and balance. Working with others and animals can help the child cross social and emotional boundaries. A therapy involving animals, pet therapy, is most similar to HIA therapy.